I just want to say, you guys are doing a great thing. It's such a uncomfortable topic to talk about, especially for a guy, young guys in their early 20s. And, I'm glad that, I could tune in and, listen to you guys.
Spencer Kobren's The Bald Truth.
Hey, Jill, are we actually streaming? Because I don't see it on your channel. Oh, here we go. Guys, welcome to the broadcast. Great to be here. Great to be next to, kind of in essence, the wonderful Joe Tillman. How are you, brother?
Aw, you called me wonderful. I'm good, thank you. How are you?
I can't complain. Actually went out last night for the first time in weeks, and as you can hear, and I have to say that when you do it sparingly, it's a lot of fucking fun.
I was going to say, it can be fun.
That's all I'm going to say. I saw a guy at the bar, 68-year-old guy. I sent you an image of him with, I've never seen hair like this in any human.
Yeah.
I wasn't sure if it was Bigfoot or an actual person.
It was Sasquatch.
And I heard him, speaking to this woman who looked like a much older woman too, and he's saying he's 68 years old. Now, yeah, I mean, he didn't look young, but his hair was just...
Yeah.
It was crazy.
Judge Napolitano style. Style, but that much hair.
But even thicker. Even thicker.
Yeah, that was nuts. That was crazy, actually. I remember thinking, like, where is this? Like, why are you sending me this photo? And then I realized, because you're out, it was a live person.
Yeah.
It was like he actually exists.
I mean, it was good enough. I should have asked him permission to put it online. But, I think he was trying to get laid. Guys, the phone number is 888-659-3727. I'm Spencer Kobren here with Joe Tillman. This is the Hair Loss Show. We are live doing our thing as we normally do on Fridays. It's summertime, so I may, I've taken a couple of Fridays off. I'm probably going to take another one off, maybe next week. But I went live on Instagram. Was it yesterday? I think it was, yesterday. And, Joe, I don't know how you feel about this, and I don't even know how I feel about talking about this, but I kind of think that since this guy puts out his whole hair loss journey to the world and has about 225,000 followers on Instagram, and callers, we'll take your calls in a second. I just want to ask Joe a question here. That kid, Zeph Sanders, I think he's a really nice guy. It's Life as Zeph, I think his handle is. And he initially started to talk about his hair loss journey using, the typical rosemary oil, topical, stuff, whatever. And then he crossed into using medications. And I think he may be taking oral meds now. And from what I understand, he is actually going or considering having a hair transplant this year.
Right.
And I thought it would be remiss of me at least not to post something on his page saying, listen, brother, you got to know what you're getting into, essentially. You might not make the best hair transplant candidate, being that you're 27 years old, you had significant hair loss, and you still do, before starting meds. He had some interesting regrowth, I will say that. But it's still relatively, I would say unstable. From what I can see, and I don't know if you agree, he has the onset of retrograde alopecia. I've seen him style the back of his hair, and you can see on the sides, it's not amazing. His temporal peaks are already recessed, even though I see him working on his temporal peaks when he's, trying to maintain his hair. And I just wanted to kind of warn him, like, listen, you should have several consultations. Don't let people know that you're an influencer if they don't know already. I mean, a lot of these guys have no idea who's out there. And, really get an assessment. And, you could always wait. He had a little setback. He went through a telogen effluvium, so he had a little setback with his hair. It could be because of the compounded medication. It could be a lot of reasons. He thinks it's stress. But the fact that he has gone through this shit already in a relatively short period of time, it just says to me that he's probably not ready, if ever, to have a hair transplant, because the downtime is going to be incredible, I believe. He could have significant shock loss. And for the long run, I don't know if he really makes the best candidate. And he seems to be getting along in life, looking the way that he does. He's a nice-looking kid with the amount of hair that he's been able to save.
Yeah.
I'm curious to know your thoughts, because I don't think this kid should have a hair transplant, and I don't want him to fuck his life up.
Well, how long has he been experimenting and regrowing his hair?
A couple of years, I think.
Okay.
I don't know when his channel started.
I'm looking at his.
Now, I also think it's
his
important
Insta
for everyone listening to know that I'm on the conservative side when it comes to going under the knife, especially under the age of 30. So my opinion is just my opinion. But I think he may be setting himself up for a fall that he doesn't realize he's setting himself up for. And that could be in 10 years. But he looks pretty good. So
I think.
Go ahead, Joe.
Yeah, I mean, I don't know how long he's been doing this. Like you said, a couple of years.
Maybe a year. I don't know. All I know is I found out about him. I was contacted by the New York Times a few months ago, or maybe last year, and they were doing an article on hair loss influencers, and it was really based around his story of trying to share his research and his journey with the world, which was cool. He seems like a really nice kid. So I'm not here to give him shit. I'm actually here to hopefully ensure that he's totally prepared and he knows the entire scope and the possible pitfalls. Because honestly, there's some good doctors out there that may treat him because he's an influencer. And they may make decisions based on that and say, well, fingers crossed we can do a good job for this guy. We're not going to worry about what happens 5 years down the road.
Well, just looking at I'm seeing him right now for the first time. I think I've seen images every once in a while, like some sort of reel or something will pop up on my feed. My gut tells me that he's not a candidate until he's been on actual medication for at least a year. Like you said that he may have started medication, but how long ago?
I think that he's using what's his name?
If it's just
topical, and I think he may have just started. I don't know. I just read some comments. He may have just started oral finasteride. I'm not 100% sure.
Well, what has he done to get to where he is now? Like I see pictures of him with a laser cap or a laser helmet of some sort, and I see him.
He's done every possible happy horse shit you can do. Derma stamps, maybe derma rolling, topical.
So everything short of real dedication to medication.
I can't say. I mean, I should have investigated more when he started finasteride. I just read today that someone asked him, like, why are you taking oral finasteride? It's poison. But I know throughout the entire journey, and at least to the point when I was asked to speak to the New York Times about, what he's doing and just the entire influencer space, I don't even think he started topical compounded medication yet. I think he's on what's his name's Hassan stuff.
Okay. Yeah, I don't think he's a candidate right now, just based on what I'm seeing and what may be his medical or medication history. As you understand it, based on that, I would say no. I would say give it at least another solid year of consistent medication use, and then reevaluate, because he could wind up being a decent candidate in a year if he continues to have a good response with the medication.
He may reverse the retrograde. His sides may get thicker, and if he's not having any adverse side effects, I don't even think a year. I think a year is too short of a time, because some people will respond to medication in the first year, and then it may not be as strong of response for long term.
Here's the thing. Here's the thing. Guys like this that have potential retro, they still have that strong band around the perimeter of their scalp on both sides in the occipital. So he might actually be a decent candidate for one good strip.
That I agree with.
Because of that reason, where if he does has significant retro coming up in the future, then a lot of those hairs would be more than likely, thinning out over the years after his surgery. So,
and I was
it's hard
talking
to say.
about,
Like
I was really referring to FUE surgery for the kid, and I don't think, and I also don't want to talk him into, if he really wants to have surgery, to having his head cut open. You know what I mean? So while
I know,
in my mind, he would be a better candidate based on the retrograde and the extent of his hair loss now for a solid strip to get as many DHT-resistant grafts out of it as possible. I also don't want to put that into his head. Like, I kind of think he's in a position, and he may be in a position mentally in the next couple of years, as unhappy as he has been, and he talked about it on his channel. He seems like a really good kid, by the way.
Mm-hmm.
He really does look good with short hair and the amount of hair that he has. And he also looks great with a shaved head. But I understand how, you want to feel the way you want to present yourself to the world in the manner in which you want to present yourself to the world. So he wore a hairpiece for like a week or something. I don't know, maybe 2 weeks. I don't know how long it was. And he liked the way that he looked with hair, and I understand that. I just don't think he's prepared for the reality of what a transplant will give him now compared to wearing that piece.
Yeah.
And also the downside, the year that it's going to take, the possible shock loss, the fact that he will absolutely, I can guarantee, he's going to want another surgery after the first surgery grows out. Will he have enough donor hair to be moved? And, who's going to work on him, because if I was advising a physician, I would tell them, you do not want to enter this realm right now. Leave this kid alone.
Right. Well, I think
I really love my drinking voice, by the way. It's low. It's like two octaves lower.
Some people have mentioned it. Some people have mentioned it.
What'd they say?
Let's see, was it Spencer's dentures are coming out. He sounds different.
That's so mean.
That's DB, man. That's DB in the chat room.
Dentures. Let me sign out so I can see the chat.
And on call 21, glad to have you with us. He talks about the topical that he's using. I wonder if that would, assuming it's being effective for him, I wonder how long it'll be effective as he gets more hair back, because the thicker, like I've talked about this before, my fear with these thicker, not fear, but concern with these thicker formulas that are like toothpaste, the more hair you have, the more of it gets stuck on your hair as opposed to getting straight to the scalp itself, which is where it needs to be. So I wonder if that would be.
Look, we just posted, and he talked about it, I don't know, on the show last week or on one of my lives, an article on the American Hair Loss Association about the issues with compounded medication. People don't even know what the hell they're putting on their scalp, and honestly, depending on the compounder, depending on the company, depending on where they're sourcing the drug from, the stuff changes.
Yeah.
The batches aren't necessarily going to be consistent, and who's checking these batches? So until we find a way to ensure consistency, and I told you there's a couple of products that have, come to us. I have not been able to work with any at this point. There's one that I'm probably going to be working with at some point, as far as providing a American Hair Loss Association trusted brand IP for them. But we'll see. It's been well over a year since we initially said that, okay, at least you're willing to provide full transparency about where you source your product, where it's going to be compounded, how it's going to be compounded, whether or not you have your own lab or pharmacy, stuff that no one even thinks about. If you're not compounding in your own place, there's a good chance that you don't have a lot of control over what's being or how it's being compounded. Your pharmacy may be cutting corners. Even the manufacturer or the company owner may not know what's going on.
Yeah.
So it's whatever. It's scary. All right, guys. Phone number 888-659-3727. No, my dentures aren't falling out. My voice is a little lower because I went out drinking last night, and that happens. Dentures falling out. What kind of animals are in the chat room? Let's see who this is.
Internets.
Hey, you're on the air. Who's this and where are you calling from?
Hey, it's Patrick from DC.
Patrick from DC. What's
Patrick.
happening?
How are you?
Okay, how are you?
Good. Wanted to ask you. I've been batting around these hair transplants for a while. I've seen a few doctors, and I think I'm ready to pull the trigger in the fall. And the one that I really liked the best, his work and everything, was Dr. Bernstein in New York. But it's been a couple years, and I know he's an older gentleman, and I'm just wondering if you guys have any, if he's even, I guess he's still there, and
Yeah, I mean,
initial thoughts on that?
to my knowledge, he's still there, and he's still performing surgery. And he's handing the baton over to his associate, who is also a member of the IHRS. But, yeah, I mean, to my knowledge, he's still performing surgery. Now, you're considering having strip by him?
Yeah, that's what he recommended when I saw him, and I was looking for very conservative work, and I even, he drew a hairline, and I asked him to move it back a little bit further because, I understand the whole long game thing, and I think I've responded some to medication, but it certainly hasn't halted. So I know the hair is going to continue to thin, and I'm going to need additional work, and I'm fine with looking balding. I just don't want to be bald.
Yeah.
It's, I just want some kind of a very conservative approach.
I just gotta say, sorry to interrupt you, caller, but I gotta say, you're the first person I've ever heard say that you had to move the hairline higher than what Dr. Bernstein drew for you.
Oh, funny.
I've never heard anyone say that before, because he's known for being appropriate, as he likes to call it, which we call it conservative. So good for you.
And
that's healthy.
His work is just, a lot of the guys I see on these other doctors' websites, I'd be thrilled with their before situation. I'm not looking for the hairline I had when I was 18 or whatever. But yeah, I just wasn't sure if he was even still there, and if he was if there was anyone else that might be worth checking out that just kind of has a very conservative approach, kind of in the D.C., New York general area.
Spencer?
I wasn't even listening to what he said. Did he ask the question about who else he should have a consult with?
Yes.
Yeah.
Yes, in the New York, D.C. area.
Now, what's interesting, and that's being a fucking pro. That's being able to read shit and just kind of hear things on the periphery and figure it out.
And I did see Dr. Lindsay here in the area, and he just wasn't a great match for me.
Yeah,
so
I mean, you have to feel comfortable. Listen, I think if you're going for a strip, you've picked, the king of follicular unit transplantation, for sure. He is appropriate or conservative. Mm-hmm. But if you want to have more consults, there are other doctors. You're talking about going, not just the D.C. area, you're interested in seeing more guys in New York, right?
Yeah, that's probably about as far as I would want to go.
Yeah, I mean, I would say you can definitely go to the IHRS. You can check out Dr. Dorn. You can check out Dr. Wesley. You can check out...
I like Dr. Wesley.
Yeah. What'd you say?
I like Dr. Wesley. Yeah.
Yeah, nice guy. You can check out Tom Law. He's an interesting cat, but he's old school. He's been doing this for a long time, and he knows how to do a strip. But, you can get your consultations, have an assessment, but I do think you're probably in good hands with Bob.
And one other question, do you have any thoughts on just adding a topical to, I've been on Propecia and more recently dutasteride for 16 years, and I just thought, if I don't want to give up the oral medication, but do you see much of a downside to adding a topical to that just to see if it can slow things even more, or is it just too much?
If you're not really progressing quickly, if you're not consistently going through sheds, or you're not seeing a lot of hair in the sink or in the shower, I mean, once you add something topically, you could hasten the process for a while. and sometimes it just screws the pooch. You know what I'm saying? If you're currently doing well on oral medication, then I don't really see the need to add topical. But
No.
some people do it and they do with success. So you're just on finasteride now?
Dutasteride, 3 times a week.
And how are you feeling on the drug? How long have you been on it again?
I was on Propecia for about 10-ish years, and then Dutasteride now for about 4. And I may have slowed it down, but it absolutely has progressed significantly since over the last 15 years.
All right, so you obviously switched to Dutasteride because you felt finasteride wasn't working anymore, or it just wasn't doing the job?
Yeah, because I definitely was still progressing.
Okay. Yeah, I mean, you can definitely speak to whoever you decide to have surgery with, if you definitely go down that route. But, I mean, we're both not doctors, but I just think sometimes, when you throw the kitchen sink at these things, I've known a lot of guys who try it and they make things worse. I don't know what you think, Joe.
Well, I'm sorry, I can't hear myself think. There's a lot of background noise.
Yeah, he's an outsider in a car or
Oh,
something.
sorry, I'm in the car. Yeah, I can hang it up shortly.
Okay. Well, I'm not a fan of compounding additional treatments on top of one if it's already working for you, and the reason being is, like, if you're going to do it, don't do it at the same time. Like when don't start all of them at the same time. I've you've not done that, but just for everyone listening, I think that's a bad idea entirely, because if your hair is being saved, or if you're getting some sort of regrowth, you don't know exactly what's working and what's not working. So if you're already using one treatment and it's working well for you, and then you add another one onto it, and you got some sort of issue that develops, then you know that it's the new treatment, not the old treatment. But the other problem I've got is if you add a new treatment, that is another opportunity for tillage and effluvium, which may or may not be detrimental to the gains that you've made. You just don't know. Like that is unpredictable, and no one can say for certain that that it won't happen. Many times it does happen. So I think, do what you want, but understand that is a possibility. So if you're taking oral dutasteride now and you want to add some sort of topical or another oral medication, just understand that it can affect the gains that you've achieved so far, and can make you go backward. You can still recover from it, but it's a big question mark. So I'm a big fan of, if you find something that works, stick with it and don't mess with it.
Cool. Well, thanks, guys. I will try again next time when I'm not in the car. Sorry about that.
That's no problem, brother.
No
Listen,
worries.
wish you
All
the best
good.
of luck.
Okay.
Yeah.
Again, surgery is always the last resort. It's not a bad idea to do more research and to have some other consults. But you've definitely consulted with somebody who knows what they're doing, so I think that's great.
Perfect. All right. Well, thanks, guys. Have a
All
good
right,
weekend.
brother. Take care. You too.
All right, buddy. Bye-bye.
888-659-3727 is the toll-free number. Let's see who this is. Hey, you're on the air. Who's this and where are you calling from?
Good evening, Joe and Spencer.
Good evening.
Hello.
Good evening. Yes.
Yes.
Who
Nice.
might this be?
This might be Malcolm.
Malcolm, how are you, sir?
Spiffing, I must say, just fine. But I'm having a rather difficult time with my receding hairline.
Well, let's hear about it.
Drought.
I'm 15 years old.
How old are you?
15.
You're 15. You sound it.
Yes,
Right.
I'm a Norwood too. I'm not happy about it.
I can't even imagine. It's got to be tough, brother.
Yeah, I'm dead serious. Like, I'm sort of obsessed with youth, and I want to be an actor. I want to be a YouTuber. I want to be a model. I want to be a dashing, handsome young man in the prime of life, and I have this receding hairline, and I don't like it.
This is a great
What can
caller.
I-
So, Malcolm,
I feel like I'm
you're really good, by the way.
Well, thank you very much, Spencer. You too. I love your very consistent hairline that you've had for apparently the last 10 years.
Thank you. I do
ask-
my best. I draw it on every day.
Has
Wow.
that been as long as you've been watching for 10 years?
No, but I checked through the channel and I saw that he hasn't changed in the last 10 years.
He's quick. That's good. That's good. Right on. So, so what would you like to know about? What questions do you
Well, I'm
have?
dead serious. Am I too young to use finasteride?
Yes, absolutely.
Malcolm, if you're actually 15, you're absolutely too young to use finasteride.
What about topical finasteride?
I would
No.
still say that you're too young.
What about minoxidil?
You know, these are questions because you're 15 years old, Malcolm. That you should have your parents take you into your doctor's office to talk to your doctor about. Because number one, we're not doctors, and number two, we're not pediatricians.
Right.
Sorry?
Well, I said the doctors that I spoke to don't know anything.
Mm-hmm. Well, most pediatricians
the
aren't specialists with this, so that would make sense.
Now,
think
wouldn't
that
it be
dermatologist-
fucking hilarious if this really was a 15-year-old kid?
No. Come on.
What was it?
So what can I do? The girls are making fun of me at school.
Well, you definitely have to speak to your parents about, these potentially seeing a doctor to get on medications. And there are some younger men who start minoxidil. We can't suggest that. We're not physicians, Malcolm. But you're good,
I would
brother.
highly suggest, Malcolm, that you find you go to iahrs.org and you find the closest doctor to where you live, wherever that may be, and have your parents drive you after you make an appointment to this doctor for a proper in-person consultation to find out what your options are.
Right. Well,
That
what
way,
you're telling me.
it won't be someone like a pediatrician that wouldn't really have any sort of grip or handle on how to deal with your 15-year-old hair loss.
Well, I spoke to a dermatologist, and he didn't really know anything. And I read about minoxidil and...
Yeah, they probably wouldn't
finasteride.
understand either, especially given your young age.
Am I too young to have a hair transplant?
Absolutely.
Okay, but here's the issue. My hair is very fine and straight and average density. This is what I've been told.
By whom?
Hair loss people and such.
Hair loss people and such.
Well, it's
Which
people have always told me this.
What was that?
People have always told me this. It's just kind of obvious. I've always had that sort of fine, straight sort of hair that doesn't have much volume. It doesn't have much of anything, in fact. It's just sort of...
I have to tell you, as a 15-year-old boy, I mean, you should consider doing voiceovers right now. Get started now.
Mm-hmm. That'd be an incredible career.
I've always wanted to be sort of a YouTuber and a voice actor and all that, but this artificial intelligence seems to be screwing things up in that domain right now. Anyway, so
that's a good point.
I'm really, really desperate to sort this out so that I can enjoy looking like a young man in the prime of life. Really unhappy about it.
Well, first of all, Malcolm, I appreciate this phone call, and it's actually a really good topic, even though it does seem like a little bit of a prank call, but it's funny, and you're really good. So I'm going to answer some more questions for any 15-year-olds who may be listening. You definitely have to see your physician if you are losing hair at the age of 15, and there are young men who start, they could be in the 8th grade and start to lose their hair. It's just, that's just reality. There are young patients that the doctors feel comfortable with putting on certain topical medications. So you need to find a physician. Joe made a good suggestion. Go to iahrs.org, find someone local. We have a couple of guys in the UK who'd be more than happy to start working with you and kind of guide you in the right direction.
Assuming you are in the UK.
Okay.
Yeah, assuming you are in the UK.
I am. How could you tell?
Brother, we're going to take another call,
It
but
was
this has
quite
been
difficult, actually.
this has been
Wait,
fucking
wait,
delightful,
wait,
by the way.
Wait. Come on, wait. Just give me a chance. I have a lot more to say.
Go ahead.
Okay, so I have a confession to make.
Mm.
I'm not 15 anymore, but that is when it started. So I'm actually 16 now, and I'm a Norwood 2, and I have a thinning spot on the top. And it's really bothered me. The people at school are making fun of me for it, and they're telling me that I'm
Jolly
like
good,
Wayne
Malcolm.
Rooney.
Jolly good.
So they're
Spot on.
making fun of me. And the girls are rejecting me and all that, and they're telling me it's because of the hairline. So,
Well, my advice to you as a young man is to really hit the books, concentrate on your career, make a lot of money, brother, and eventually that's going to be your
won't matter.
equalizer. It's not going to make a difference.
Yeah.
Okay, but the problem is that I don't want to have a career in the things that I want. If I'm going to have this appearance, it really bugs me.
So this is like,
Yes.
sometimes when a joke goes on too long.
No, this is not a joke. This is not a joke. I'm just trying to work up to something. I'm telling you my backstory. Trust me, this is going somewhere good.
All right, so let's hear where it's going. Let's get to where it's going.
Let's hit the fast forward button.
So fast forward a few years, and I'm now 18. I'm a Norwood 4, right?
Mm-hmm.
So this is where I was a while ago. I have to confess I'm not quite 18 anymore, but when I was 18, I started using minoxidil, I believe. And unfortunately, my dad started losing his hair when he was about 17, 18 or so, and so I think I inherited his genes for it. And so it's incredibly aggressive. So the minoxidil, what do you think it did for me? If you had
No
to
idea.
guess, it did fuck all.
Yeah.
All right, brother. Listen, Malcolm, we appreciate the call. This was an incredible effort.
Well,
And
he's actually telling his history up to the point where he's now 47.
Yeah.
And he's talking about.
No, I'm not 47, but I seriously, this is taking me a lot of. I've actually been watching your show for quite a few years now, and I would like to get this out there and see what you think, Joe. You've been telling me to call the show for quite some time, so I just want to see what you think about it.
Okay. Well, how old are you today? Your actual age?
Okay, my actual age is 29.
Malcolm, come on.
That's my actual. That is my actual age. And the voice that I'm putting on is because I'm very, very shy, okay?
I understand. Okay, so what's your hair loss like today? You're a Norwood 4 at 18. You're a 7 now.
Yes, I was a 7 by 22 or so.
Okay, all right. So as a 29-year-old Norwood 7, what is your current regimen? Are you doing anything to prevent any further hair loss? Because it can get worse, especially if you're 29 and a Norwood 7. It can get worse. Are you doing anything to deal with it?
Yeah, let me story that. So can we just backtrack a little bit to when I was 21?
No, it doesn't matter. What matters is what's going on right now. Are you taking medication?
Well,
are you doing anything? Hold on. Have you been to any doctors, and what have they told you as far as your options?
Yes. So when I was 21, I believe, I went to Dr. Ball in England. And he told me that
where was he 8 years ago? You said you're 29, so 8 years ago, that was when you're 21. So where was he? Where'd you do the consultation?
Gosh, the Portsmouth.
Yeah, he wasn't in Portsmouth 8 years ago.
Well,
he wasn't even on his own 8 years ago.
Well, maybe it was 7 years ago. I'm not sure. Anyway, so I'll tell you something. He told me that my goals were unrealistic. And I told him,
that sounds like him.
What if I do SNP and body hair, and I also do a conservative hairline, like a Norwood 2, and I also do I also use topic powder because I was using topic powder at the time. And I also do a mega session FUT and also FUE. And he said, even if you do all of these things, it still wouldn't be enough. And I left the building in tears because I was so upset. And
Well,
I
that
think
makes
I
sense.
had
But also, to be fair, he's not the guy to talk to about mega sessions because he just doesn't do them. Never has.
Well,
Never
he
has.
suggested that I might go to Hassan and Wong.
Mm-hmm. And of
But
course,
he also said that
they do mega sessions, yeah.
He also said that my scalp didn't have enough laxity for an FUT, a good one.
Mm-hmm. Mm-hmm.
And he also said
Okay,
that
so-
my hair was too fine.
So who else have you seen since you saw Dr. Ball?
I saw a Dr. McCluskey in Scotland,
Okay.
and I reached out to a bunch of other surgeons, and I spoke to a Dr. Lupin Zula, and these were all doctors, well, some of them were doctors that were working with you at the time and with the Hair Restoration Network, right? And so I was sort of keeping this rather secret. I was always wearing hats. I was always doing comb-overs and extremely elaborate comb-overs as well. And I think that I might have had body dysmorphic disorder. I think that it sort of turned into something really quite sinister.
Okay, so then
have you,
which doctors said that they do surgery for you?
which doctors? I was told that Dr. Bizanga and Dr. Lupinzula and Dr. Bloxham and Dr. Jeffrey Epstein and there might have been a few others as well. There was a doctor, the guy in the Netherlands?
There's a few, but which ones said yes?
These ones all said yes. These are the ones. The other ones all said no.
Okay.
Right.
So okay. So why haven't you done anything yet?
Well, I did. Dr. Ball suggested that I get a hair system. And I looked into that, and I thought, wow, that seemed like quite something. Maybe I'll go get one of those. And so I got one.
Okay. And apparently you're not happy with it.
Well, do you think that I should tell my family about it? Do you think that I should be open about it? That's the question that I was dealing with.
Oh, goodness.
Or should I keep it private?
Well, that's completely up to you, and only you can answer that. Like, I'm personally, I'm not a fan of trying to hide stuff like that because...
Well, my question here is, how does your family not know if you're wearing a system?
Exactly.
Well, the strange thing is, I wondered if they did know, but I hadn't actually...
So you started balding at the age of 15. You are now allegedly 29. You were Norwood 7, who's now wearing a piece, and you're wondering if your family could figure it out. I got to go, Joe.
Yeah. Well,
yeah, they probably know. They probably know.
Yes, I thought so, but my brother was at university at the time, and then when he came back, suddenly, my comb-over was so good and so elaborate that apparently he didn't really know about it. And people seem to have a short memory for these things. So he never said anything, and my stepbrother never said anything. Nobody really said anything. They just said, nice hair, nice hair. And I thought, that's lovely, yes. I like it, yes. But I didn't actually tell them. And so maybe a few months after... So maybe a few months after I got the hairpiece, I was thinking there's something not quite right about it. Can you guess what that might be?
That it's fake hair?
It was the wrong color?
Well, it was too thick.
Or it was too thick, or it was too low on the hairline.
No, it was too thick, and it was the wrong color. But I sorted those issues out. But there was something else that was not right about it, and that was the temple points.
Ah, yes. The bane of all advanced Norwoods. Exactly.
Yes.
Okay.
Yes. My temple points have been royally screwed since the age of maybe 18 or so.
Mm-hmm.
So the other issue was the hairline, because I was self-conscious and I didn't want people to notice the lace. It made me self-conscious, and I thought I need to find a way around this. So I considered the option of getting surgery for either the temple points or the temple points and the hairline.
Well,
What
here's
do you
the
think
thing.
about that idea?
I think that is a great idea if you are one of the very rare people at the age of 29 that has the maturity and the foresight to commit to a lifelong use of a hair system. And I say that because the moment that you decide to do a hairline and then wear a system behind it, you're basically setting yourself up to being stuck with it. You're locked into it because, I mean, you can conceivably ditch the hair system later on and do a transplant behind the hairline, but you would have nothing even close to full coverage that you currently have with a hair system, assuming that you've got a standard front to back system. So it can work great. I've seen it done, but ethical doctors will really put you through the ringer as far as asking you questions and making you wait to make sure that you're ready for it, because it's nothing to take lightly. It's a lot more serious than just getting a hair transplant and calling it a day. You're relying on a combination of treatments that have to work together for it to be something you can pull off. So it can be great.
So are there potential downsides with this as well, this brooch?
I'm sorry?
Remember, my goal, I want to be an actor. That's one of the things I want to be, and a YouTuber. I want to be sort of an influencer, actually. So this was actually
Right.
when I was 24. This was 24 that I was considering this. Right.
Mm-hmm. Okay, so
And
that
I
was
did it.
how long ago?
5 years, 29.
Malcolm,
Yeah.
I'm gonna interrupt here, Malcolm. I want to thank you for the call, and I want to let you know that we're here for you. You can call us any other time, but we're going to take some more calls now. I think Joe did a pretty good job trying to answer your questions, and
Can I ask one more question for Joe?
it's up to
Sure.
Joe.
Yeah, one
Are
more
you
question.
going to do the main? Well, two questions. First of all, are you going to do the main event anymore?
Yes. Yeah. I just
Okay.
did one,
The second question is,
what, 2 weeks ago?
Hattingen, yes, I missed it. I missed it. So the other question is, can you guess who I am? Because we've actually interacted before.
We've never spoken before.
We've never spoken before, but we have interacted.
Yes. No, I have no idea who you are.
Okay. Well, jolly good show, and have fun with the rest of it. And tomorrow I'm meeting with Dr. Bassman.
Unless this is Serge from New Jersey. Is this Serge from New Jersey?
No, this is someone else.
Ah, okay. Yeah. No, I don't know.
I was
Sorry?
hoping to talk more with you, but I suppose you do have other calls and such. So maybe next week or so. I'm not sure.
Well, not sure we'll be on next week due to prior commitments, but we will be back on at some point in the next few weeks, and you're welcome to call back anytime.
I've been having serious issues with this, so I would appreciate it. Thank you very much.
Take it easy, Malcolm.
Not a problem.
Good luck.
Take care, Malcolm.
Bye-bye. I don't even know what to make of it.
Apparently, I've interacted with him somehow.
He's very creative. I'll tell you that.
There was a creativity there that I didn't expect. I do have my suspicions about who it is, but I won't say it on air just because it doesn't matter.
It's fucking Furco.
No, but that would be good.
But I mean, that would
I'd be impressed.
Impressed. A lot of talent. 888-659-3727. Let's see who this is. Hey, you're on the air. Who's this? And where are you calling from?
Hey, this is Eddie from Houston.
Eddie from Houston. What's happening, man?
I know who it was.
Wow.
It was Milk Drinker. Sorry, Eddie. It just hit me. That was Milk Drinker from the chat room.
Really?
Yeah, I've been trying to get him to call forever. That's Milk Drinker. Milk Drinker, I know you're listening.
Great job.
Confirm it. Confirm it in the chat room. No, you don't need to. I know it's you. Anyway, Eddie, how you doing, buddy?
What's up, Eddie?
Oh, that was challenging to listen to.
Yeah, we're probably not going to put it as one of the highlight reels, but
he just confirmed it. Milk Drinker, longtime listener, in the chat. He just says yes, it was me, or he just said yes. So
it was
anyway,
definitely creative,
Eddie,
and it was funny for the first 7 minutes. But
yeah, what can we help you with, Eddie?
Right. All right. So I had a surgery about less than 3 weeks ago with Dr. Wong, and I was doing the FUE into the scar area, donor scar. The scar area.
Mm-hmm.
I've noticed. I saw your video when you did it. It looked really good. So it's promising. It looks good so far. I'm assuming I'm going to lose some the hair over time. The what do you call it? The new hair that's in the scar area. I think that's going to shed.
Yeah, it'll shed. Yeah.
Yeah. So I don't know how long, but right now it's still there. But if that's the result I'll get, I'll be very happy. It'll look really good. So, but then I have an infection now, and I didn't know what's going on. I just couldn't. It was very irritating around the neck, around the nape area, all the way up to the scar line.
Mm-hmm.
And I thought maybe just let it go. Just it'll go away after a few days. It'll just wash it thoroughly and just.
Well, hang on. So stop for just a second. Back up. So, from the nape of the neck up to the scar line, you have an infection. Is that what you said?
Yeah, up to just below the scar line. Yeah.
Okay. So, were those the extraction points? Was below the scar line where the FUE, where the grafts were taken? Okay.
Correct,
so it's the extraction points that you feel are infected. So. What kind of symptoms are you having to think that they're infected? Or did someone tell you they're infected?
Yeah, I sent pictures to the doctor, and it's reddish. It's pretty red, and it's not smooth. You can feel it's bumps, hills. It feels little, and it itches, and it's in that center area, so it's it's very annoying. And then when I tilt my head down, it feels like a stretch. It's a little tight.
Okay.
So,
yeah. Well, that's. I mean, feeling tight after surgery is normal, regardless. But, were you prescribed any sort of post-surgical antibiotics? I mean, you get them anyway. You get antibiotics after surgery anyway to help reduce the chance or the severity of this. But was something else prescribed in addition to, or did the doc say push through?
Push through meaning he didn't give me anything.
Okay. Well, you didn't. Okay, so you got a bag when you left the clinic, right? After your surgery.
The bag, but not for any medicine. Just the shampoo and the pillow covers.
Mm-hmm.
And the instructions.
Are you saying that you were not provided with antibiotics or given a prescription for antibiotics?
Or sleeping meds or pain meds? Nothing?
Oh, just the pain meds, but I didn't have any pain, so that was good.
Okay.
But yeah, no antibiotics, which I was kind of surprised.
Well, I am too, because that used to be standard. So, okay. All right, so you don't have it. So what did Dr. Wong say?
So he prescribed doxycycline and told me to take that for after connecting with him 2 or 3 times. It was just through his secretary. Basically, he said take it for 4 days, 21 days, but for the first 4 days,
take it twice a day.
Take it twice a day. Okay, so twice a day
yeah.
for the first 4 days, and then complete the rest of it after that. It's just once a day after that.
Okay, so go through the entire supply for the next however long, however many tablets he gave you. Okay.
So.
Let me ask you, Joe.
Okay.
I mean, you,
All right.
you said it was it's normal protocol normally to send somebody home after surgery with prophylaxis antibiotics, right? Yeah.
Yep. Yeah. So it's kind of odd.
Yeah, even if,
I mean, you get that when you have a tooth pulled.
Yeah.
so it was only like just a little over 300 grafts, so it wasn't a big procedure, but it was enough to. That's what I need for the hair for the scar area.
Yeah, but
So-
as soon as there's an incision made into your scalp, there's always a chance for infection.
Yeah.
Yeah, I don't know why. I kind of regret that because I remember the first surgery I had an infection, and then they gave me antibiotics after that. Not with him, but I think Dr. Wong gave me antibiotics the last procedure I had with him, which was an FUT. I think I had antibiotics with that, but I thought maybe because it's a small procedure, it wouldn't make a big difference. But they said I didn't need anything, so I mean, I'm just going by what the doctor said.
Well, to be fair, like it could, like the protocol could have changed simply because it is a small procedure and the wounds do close very fast because he's using a small punch. It's a trumpet punch, so the wound does cover itself up, not healing, but it does scab over pretty fast. So you know, playing devil's advocate here, that could be the normal protocol for a small surgery like this, like you said, and it may have been like this for quite a while without any sort of need to change it. I can see that, but at the same time, you know, in my opinion, I'd be playing it safe by, you know, putting some in everyone's bag, no matter how small the surgery was. But yes, okay. So today you have this antibiotic. It's been prescribed to you. You started taking it, correct?
How are you doing?
It's my first day,
right.
So I'm just.
Oh, okay.
I'm a little concerned. I just want to make sure that I didn't cause any harm or anything. There's going to be issues with the grafts that were planted.
Well, I mean, I can't imagine you doing anything that would have caused harm. I mean, sometimes, you know, I mean, sadly, after surgery, any type of surgery, you're prone to infection.
Yeah.
So I am a little disappointed and surprised that you were not prescribed, and I'm not a doctor, not prescribed antibiotics prophylactically.
Yeah.
For the surgery, and but I don't think you personally caused any harm. And how bad is the infection right now?
Well, I don't know how to measure it, but it's definitely red.
Is it painful? Is it oozing?
No, it can be. It's extremely irritating at times.
Is it very warm?
Yeah. It's a little warm, but it's definitely, there's a lot of bumps, okay. And then there might be like 2 whiteheads or something like that, or, just where the ones, I think I was told to lance it or pop it.
Yeah.
Yeah.
But I don't want to mess with that. I don't know what to do at the moment. I think I'm just going to take the medication and wait a few days, see what happens.
Well, I definitely think, and we're not doctors, but, you do want to take the medication as prescribed, see what happens. I mean, it seems like the infection is relatively minor at this point from the way you're describing it. So even a couple of days on Doxy should get you to the point where it's clearing up. And the only reason he's putting you on an entire course of 21 days is to ensure that it doesn't come back.
Yeah. But in the meantime, because of the infection, is that going to cause any problems with the procedure? With the results, and will it impact my hair negatively in any way?
Well, is the scar line itself included in the area of infection?
If anything, it'd be right in the center, maybe 1 inch wide, 1 to 2 inches wide in the center. Or just
so the infection, the infection goes above the scar line?
No, just below.
Oh, okay.
At or below.
Right. No, you should be fine. And I was also going to say that one thing you can do is if you're having these almost like pustules forming because of the infection, you can get a cloth and run it under some hot water, and then just lay down face down someplace and put this cloth on that area to let it soften things up, and then you can you can relieve those pustules, and then make sure you dab a topical antibiotic ointment onto it, and that can help to clear that up a little bit. And relieving some of the pressure, because I know some of those can hurt. Like when you have a transplant and the grafts are placed, and then three months later they're starting to pop through, they can create some pretty serious pimples that hurt. Just by their existence, they hurt because there's so much pressure built up. So you put a cloth that's been soaked in hot water on top of it, kind of opens it up a little bit, and you can literally squeeze them out, and it's like you're a teenager all over again. And then put some antibiotic ointment on it, and you're good. Same thing for the back. Same thing for the donor, and you should be fine. Like, even if you don't do anything like that, just go through the course of antibiotics. That's also just fine. You don't need to do anything above and beyond that. But if you want to be proactive with that pressure issue, that's just one thing you can consider.
I was thinking about going to a local doctor, maybe have him examine it and see if there's anything if he should pop any of the pimples.
I mean, I don't think it's a bad idea to see a dermatologist locally and just at least to take a look at the infection.
It can be good for peace of mind, for sure.
Yeah. I mean, I thought I was out of the woods, and I didn't, and this came up, so I was like, it looks very promising, but then I got really disappointed. I was like, God, I don't need another complication.
You may not have a complication.
Don't let it bring you down.
You know, you may not have a long-term complication. This could be just the unfortunate situation. You have an infection. Yeah. It could be resolved with medication, and everything can just grow in perfectly, and you'll be great.
Yeah.
Yeah, that's what I'm hoping for.
It's not like you have necrotic tissue or anything. I mean, I think it's unfortunate. I think that it probably could have been prevented, this is not your fault in my view at all.
Yeah.
I'm disappointed that this is the case. So I think it's certainly important for listeners to understand that they need to know what medications they need when they leave on that surgery day and go home.
What do they usually get?
Agreed.
It depends it depends. You know, there's painkillers, pain medication is prescribed in many cases, and antibiotics.
Yeah.
You know.
Okay.
Some clinics will provide topical ointments as well. It really depends on the clinic. But
I did do.
Go ahead.
Sorry. I did an add-on afterwards, the same day, exosome.
Okay.
They used a derma roller for the top of the scalp, and then they just applied the exosome all over the wounds. And topically, yeah, and also in the donor area and the scar area, they applied it everywhere. Yeah. But I think they only did the derma roller on the top.
Now, was that an upcharge?
Yeah, it's $300.
Okay.
So and you can do it. They recommend doing it for 3 sessions, a month apart.
Now, are they saying that they think that provides a better end result?
Yeah, they're saying people heal better with that. And
so why don't they throw it in for free or include it in the surgery?
I mean, they're probably just covering their costs or something. I mean, not everybody wants it or.
Well, at $300, that's pretty damn cheap for exosome treatment.
Yeah, I mean, to me, and again, this is not to criticize anybody, but we were just honest here on the broadcast. To me, if a physician thinks that their patient is going to have better results and better healing using exosomes, then that should be part of the cost of the procedure. Not like, well, if you want it, it's $300.
Yeah, maybe for the first procedure, but then after that, what about the next 2 applications? Because they recommend 3 months of total.
I think if they recommend that as part of the healing process, then that should be absorbed or put into the cost of the surgery, so that it doesn't seem like it's an add-on. It's not like you're buying undercoating for your car. You know what I mean?
Yeah. I hear you. I mean, that's their call. I just don't know how effective it is. From the research I've seen, it's
the verdict is it's not in yet.
Yeah.
You know.
So, but it wasn't a huge cost, so I'm like,
well, no,
okay,
it's still cheap. It's cheap enough. It's not something that is going to break you.
Right.
And as long as it's not going to hurt me, that's my main concern. I don't want anything to have any like negative side effects. That was my main concern.
Yeah, well, I don't know if it can. Depending on the batch and all this stuff, it doesn't seem like. I don't think Hassan Wong are going to provide an inferior product.
Correct. Yeah.
So I think you're probably pretty good there. And just to allay your fears, I know this sucks, but there's a very strong chance. I mean, it's just going to be like, okay, this is just something that happened. You're going to heal, and then you're going to have great growth, and that's it.
Yeah. Yeah, I'm hoping that should be the case. I mean, from what they said, it wasn't anything extreme, but
no, it doesn't sound extreme, and it sounds like I mean, maybe you could have caught it slightly earlier, but
I thought it was just part of the process. I've never had FUE before, and I was like, okay, well, it's just swollen. It just, it's normal. You're going through phases, and I'm like, man, this is just not healing, and it's starting to irritate me more, and I can't sleep on my back. I was like, okay, something's wrong here. I better check with them.
Yeah. Well, I'm glad you did, and I'm sure that you caught it in time. And I'm sure. I mean, I don't have a crystal ball, but judging from the way you describe things, I think you're going to be fine.
Yeah, I think that I'm hoping that's the case. And Dr. Wong, I mean, maybe they overlooked it, maybe thought it wasn't necessary, but I mean, they do good work. I don't want to.
They do great work. They're some of the They're some of the best in the business.
Yeah,
and they always have been. I mean, this is not I'm just very honest. It doesn't matter, I mean, I if I see something that needs to be looked at with a jaundiced eye, no matter who the doctor is, I'll tell you.
Yeah,
so,
maybe I don't know if you guys will pass it along, or
Oh, someone's listening. Someone heard this.
Yeah,
they know.
But I just hope if it looks as good as it looks right now, man, I'll be very happy. I'll be very, very happy.
Well, you know what? Why don't you call us back and let us know, and I'm sure you're going to call us back, and you're going to be a happy camper.
Yeah, I think it takes about 3 to 5 months minimum, maybe 8 months to see the results. If I'm not mistaken.
It depends. I mean, you're going to start seeing stuff in a few months, but you're not going to see the scar's not going to be completely grown in for, I mean, 8 months to a year.
Yeah.
So,
okay.
All right, brother. Listen, good luck. I hope you were able to lay your fears. I think it sucks that you have to be on antibiotics this long and now, but you're going to heal.
Yep.
Yes.
All right.
Thanks, guys.
All right. Take care. Bye-bye.
Right,
good luck.
Bye.
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 888-659-3727. I'm not here to, wag my finger at anybody. I'm just wondering if, someone just forgot to put in the bag.
That's what I was wondering. I've not looked at that part of the. I've not even been to the clinic in several years, but and they wouldn't be calling me up saying, "Hey, Joe, by the way."
Yeah, we stopped prescribing antibiotics after surgery.
If this happened when I was at the clinic, then that would have been an oversight where someone just didn't put the little bag. It was just a little plastic baggie that would have the different medications, the sleeping meds, Imavane, which is fantastic, Tylenol 3, and Keflex, enough for 4 or 5 days, which is a mild antibiotic.
And that's what they give you when you have a tooth extraction or dental work and any type of invasive, minimally invasive or invasive procedure.
Yeah. So
I don't know. That's a big question mark. What's up?
Someone's saying I'm freezing on screen, but okay, I see what's going on. It's sometimes choppy. Yeah.
Let's see who this is.
Yep.
Hey, you're on the air. Who's this and where are you calling from?
Hey, gentlemen. Mike in NYC. Long time no speak.
Mike, what's happening, brother? How are you?
What's up, bro?
Hey, Oh, not much. What's up? Everything? Well, I guess things are a little bit could be a little better, but
Why? What's
that's why
going
I'm calling
on?
it.
What's going on, man?
I just I kind of thought my sounding down phone calls to this show would stop, but it's I guess I'm struggling right now because I'm 6 months post second surgery, and which obviously I'm at the point where growth should be popping soon, but I'm just feeling down about the way things look as far as just my overall feeling is leaning towards the negative side right now. I just thought I'd be so past that. And I guess I'm just struggling. You guys know the deal if you remember correctly. I'm not on finasteride, and I think maybe I was fooling myself a little bit to think, even with the super conservative 2 surgeries, that I'd be in the complete clear.
I forgot who'd you end up going to again, Mike?
That's the thing. I'd actually rather not, even though I told you before, because some people just jump to conclusions, I'd rather not go mention the name right now.
Okay.
Because even though
let me go back in the archive so I could do it. Hold on.
Exactly. Let me look at my notes.
Yeah. Get him, Joe.
Well, initially, I was rejected because I wasn't stabilized. But after much discussion, we talked about this very conservative route. Multiple surgeries would be needed. I just thought I would come out of the second one being so great, and that this third and final one that I would have in my back pocket still maybe wouldn't even be necessary. And now it's like I already kind of see how it's not only going to be necessary, it's going to probably be sooner than later, even though I envision maybe it'd be a while. The main thing I'm struggling with is, I'm 6 months out, and I kind of fear that maybe some of my initial forelock has maybe thinned a little more.
So you mean your initial forelock before it was transplanted? Your native hair?
Correct, right. So pre-original surgery, I had a somewhat decent forelock still in place. So I have like this amazing hairline that I'm happy with. It's very thick and the hair is long, and that's all transplanted, right? But the part that really turns me off is the fact that very quickly behind that, it's pretty significantly thin. And the second surgery, in my opinion already, is not going to be able to play catch up with that. Like he did do some work in that area, but for the most part, the second surgery was giving me some decent coverage in the crown area, which was the only area left that was really, really, really thin, bad. Right. So it was that the hope after all the second surgery was just like pretty much solid coverage in the frontal third and decent in the crown. And now it's already looking like, I shouldn't go crazy. I should really probably be having this call in another 4 or 5 months, but I just have a bad feeling about it because...
is the bad feeling because you're not seeing hairs pop out yet? You're not seeing the growth, or you think you're losing ground while hair is starting to grow?
Well, that's the thing. I'm leaning more towards the latter because the part I'm not really saying so much because I don't even want to think it's accurate yet is after the first surgery the journey was complete, I had this really, really amazing frontal third looking with, no real issues. And it looks like, I'm not 100% sure, but it looks like that may have changed a little bit because mind you.
Now, do you think it changed due to the surgery, or do you think that it's just a natural progression?
Well, that's another great question that I've thought about, and you're talking about like with regards to shock loss, possibly.
Regards to shock loss, regards to changes in vasculature because of the surgery.
The story. Yeah. So we went. The story is, in a quick summary, we went around. It was mostly focused on the crown, and we went around the forelock in like the corner areas or whatever you want to kind of call them, like the channels or parietal areas, right? Mm-hmm. And it was a little weak there, but there was hair, basically a nice little amount implanted into areas that there already was, semi-decent amount of hair. So yes, shock loss could have been the case. And if we're talking about 6 months post-op, that you would think that hair would have returned by now, right or wrong?
Well, in some cases it returns, in some cases it doesn't.
Correct.
Shock loss.
Right.
You know, that's always been kind of like, I'm sure that, you know, initially when you first started to call us, you know, because I'm so conservative with this and because I want people to know the entire scope and all the possible pitfalls, I probably talked a lot about shock loss, right? And the potential of it not growing back.
Oh, and yeah, I know.
Yeah.
No,
I'm not here to say I told you so. I just don't remember if I really try to drive that home. I usually do.
No, I mean, I wouldn't have even needed to listen to the show, considering how much research I've done and videos. I know that shock loss is a possibility, and especially my big thing not being on finasteride. But you know, just yeah.
And are you not on finasteride? Remind me, because you had side effects, or you can't take it for another reason? Okay.
Yes, bad experience on that, and correct.
Mm-hmm.
So
now,
right now,
were you given, or did the doctor talk to you about the potential of getting on oral low dose oral minoxidil? Not that I try to push people on that at all, because to me that's also could be questionable.
With that, So before the surgeries, I was very gung-ho on trying really to maintain what I had left. And one of my last options was this oral minoxidil, since that seemed like all the rage at the time. It started coming up. And I was basically flat out rejected by my dermatologist because it's not FDA approved. And, you know, I understood that. And, you know, you read things about that.
Well, you know, honestly, none of the stuff that's being sold is FDA approved, whether it's
finasteride is.
Well, Keeps or Hims or any of the compounded products that are out there. The FDA really has no oversight. So
even dutasteride.
Yeah.
Correct.
Well, dutasteride is absolutely not FDA approved for hair loss. But, you know, when I talk about compounding, they use FDA approved meds in compounding variants.
Yeah.
Those compounding variants are not approved themselves.
Yeah.
So, yeah, I mean, I understand where your dermatologist, where your doctor is coming from. If they don't prescribe it on a normal basis, on a regular basis, you know, and in their mind it's for hair loss. But what I find interesting is, like, I don't know what the percentage is now. It's pretty high percentage that of drugs being prescribed off-label for everything now, you know?
Yeah.
So
it's definitely increased.
Yeah, so it is surprising that someone, especially with a drug that's been around for 30 years.
A lot of doctors, though, still stick to that line if it's not FDA approved for the intended use. Like there are doctors out there that are absolutely against off-label prescription, and I don't understand why. I really don't.
Yeah, but dermatologists used to prescribe Retin-A before there was an actual.
Oh yeah, but this particular dermatologist probably didn't. That's my point. It's like there are doctors out there that just refuse to do off-label scripts, and maybe it's to cover their ass, or maybe they're just so regimented in their education.
All right, Joe, keep your shirt on, brother.
Don't believe it.
I get it.
No, these doctors piss me off. These doctors piss me off because they're doing their patients a disservice.
No, they are.
Just saying.
I kind of disagree with that, to be honest, if I'm just being honest. Like, I don't know. Tell me if I'm wrong. This is a medication that is not approved for hair loss, and I think it is like a liability thing, right? Like he gives me this, and you know, it could interfere with whatever the story is with your heart. I mean,
personally, I feel it's a stretch because there's so much supporting evidence out there to back it up. If it was something just, you know, one doctor, you know, being the rebel of the group and doing something that no one else is doing, then absolutely. But finasteride is still prescribed off-label as Proscar. Proscar is not FDA approved for hair loss, although the smaller dosage as Propecia is. And there are doctors out there that will not prescribe 5 milligram Proscar for hair loss. They refuse to do it. That's my point. It's like they just if it doesn't say on the box for hair loss, then they're not going to do it.
And as far as liability these days, you probably signed a arbitration waiver just to see the doctor. This is the sad part of the medicine. So they're not going to be. They're not that concerned about liability in that respect. And they
Right,
are
right.
legally able to prescribe medications off-label. So they're not doing anything that's, out of the scope of practice. But, maybe he doesn't or she didn't think it was safe, personally. So
Right.
for that, I could
Right.
understand it.
Well, maybe years down the road, if that drug ends up having a big enough following like Propecia or finasteride has, things might change a little bit, right?
It already has a huge following, and most dermatologists will prescribe it like candy. So it's it's just the way
Yeah.
that it is. But listen, you're struggling, and I'm sorry to hear it because the last time we spoke, you seemed pretty happy, and then I remember you saying you're going for another procedure,
Yeah.
and you're willing to kind of risk that, and but you're also only at 6 months. If you are suffering from any shock loss, it's still possible for some of that hair to grow back, and you don't know what it's going to look like when the transplanted hair grows in.
And I was going to say,
yeah.
I was going to say that before, and I got sidetracked. Sorry about that, but I agree 100% with Spencer. 6 months is 6 months, meaning you're just at the beginning of the potential reversal. So, I've said so many times I can't even count that when you have a hair transplant, don't expect the first signs of growth until between 3 to 5 months. But if you have shock loss on top of not shock loss of the grafted hairs, but shock loss of loss of your native hair. Sorry, can't get that out. It can take longer, and countless people are at your stage at 6 months and say, "Man, this was, a big mistake. I'm worse off now than I was before I had the surgery." And then at 8 months, they're like, "Holy shit, this is wow!" Like it's like a switch was flipped, and it's fuller. Things are coming in, and it just gets better. So you could very well, there's a good chance that you could be right there.
Well, my big moment in the first surgery journey was actually later than I thought. It was around the 9th month where everything's really picked up, and it even surprised me a little bit. 9, even close to 10 months too, and there's no doubt I haven't gone to full quote unquote panic mode yet. I'm definitely giving it the next 4 or 5 months. Yeah.
Look, even after my second repair surgery with Dr. Wong, when I was supposedly, this veteran now that understood everything, I was freaking the F out at 5 and 6 months. I really was. Because I had my second surgery, and it's just like, I had an initial burst of growth, and then it's like, is that it? What's going on?
Right. That could be.
And then at 7 and 8 months, it was like a flip of switch. It's like, holy wow, okay, and it just kept getting better. So until it didn't. So yeah, I mean, I feel you, man. I've been there. It's deflating. It's totally deflating. But you start seeing that kick back in, and you'll be on cloud 9. So
yeah,
keep the faith, man. There's a good chance it could turn around for you. That this is just temporary.
No, 100%. I agree with Joe.
And
we've heard these. You know how many times we've heard these stories, Mike? And then someone will call back or someone will write, and it completely turned around for them.
Yeah.
Well, I hope this is one of those phone calls. I guess we won't find out for another 4 or 5 months, but I hope it's one of those phone calls.
And I hear the angst in your voice.
People. I wish more people would talk about how, like I've said, like I can only say it so many times, and Spencer can only say it so many times, but the easy part of hair transplant surgery is hair transplant surgery. The hard part is the first year after surgery, because all kinds of crazy 100%. Shit happens.
100%.
And it will break the people that think that they're strong people. It'll have them crumbling into tears. They won't know what to do with themselves.
You know what it is?
It really tests people.
The story is
kind of like marriage.
I was on cloud 9. The main problem is I struggled so much before these surgeries, and after that first surgery, I was on a level, and you heard me at the previous phone calls, where it was just unbelievable joy. And
Yeah.
to think that I've kind of reverted back a little bit because I guess I expected a little more at this point to feel a little better. It's really a compound job of negative emotion, going back to, thinking about my hair again a little bit, which really had just gone away for a good long while now.
Well, if I'm going to be completely candid, there's a large percentage of people who have hair transplants never fully, they feel better, but you'll see them in our chat room. You'll see them on the forums. You'll see them really still obsessed with the next move they're going to make.
Yes.
And very few people, unless they're really equipped to understand the reality of what a hair transplant is, can walk away and just feel, all right, now I have my life back.
Right.
That's just the reality of this particular cosmetic surgery.
Yeah.
You're dealing with a moving target. You're not getting your nose done or like a genioplasty, whatever that is, or an implant, put in, or, it's a moving target, and it's constantly evolving, your situation. So my hope is that you call us back in a couple of months. You could always call us back sooner if you need some help and some advice, obviously.
Yeah, call us back anyway.
But, my hope is that when you call us back, when things start to pop, that you're going to be satisfied, and there's a good chance you can be. So I just want you to keep that in mind.
Well, thanks again for your optimism for now, and I definitely will speak to you guys in a few months. Absolutely.
All right, brother. Good luck.
All right, Mike.
Keep your head up. Keep your chin up.
Take care, Joe.
All right, later. Bye-bye.
All right. See you.
And the name of Mike's doctor is, anyway, 888-659-3727 is the toll-free number. That's the nature of this game.
Mm-hmm.
And I would say a large percentage of guys are never fully satisfied. There's a smaller percentage of guys that are just usually older men, to be honest, that are pretty satisfied with their, like if you're over 40 and you've been pretty bald for a while and you get a transplant, these are the happiest patients.
Of course.
Yeah.
I had someone explain it to me from their point of view many years ago when I was still a consultant, and the question was, why can't doctors, or why won't doctors restore the hairline of a teenager on a lot of these patients that want it? Why do they say no? And
like
the
Rob
logical
Hellner.
answer, like Rob Hellner, the logical answer, if you've been in this business and you have any sort of sense about you, is supply and demand. In the long term, if you blow your wad on the hairline with 4,000, 5,000 grafts, which is what's necessary to achieve some of these goals, then what are you going to do for donor hair when you turn into a Norwood 6 10 years later? You're done. You're hooped.
Yeah.
You've kicked your bucket. But the I lost the point. So
Did you really have one?
Not really. The position of argument that this person had that I was speaking with, he forgot the logic and the math behind the situation. But what he said to me in response, I've never forgotten. He said, "Well, it's easy for you to say, because when you were bald for years. I just lost my hair 3 years ago. I haven't forgotten what I look like."
Yeah.
And that makes complete sense.
It does.
Complete sense
That's
as to why older guys
stupid kids
are happier with their results.
That's why I tell these stupid kids, you got to figure it out. Go out there, make some money, live as well as you can, and get used to the way this looks as it progresses.
Yeah.
And in time, you may be able to get some hair back, or a good amount of hair back. And you'll be so satisfied with a normal, recessed hairline, or as Rob Hellner likes to say about my island, whatever he calls it. That motherfucker. But, and guys, we'll take your calls in a second. When I think about this kid, Zeph, and I see what he's been through to try to grow his hair back and the journey he's on. God, it makes me cringe to think that he may have surgery now. When maybe in a year, when he's on, if he's taking, he starts taking oral meds, or if he's taking oral meds now, he could get to the point where he may not even need it. He seems to be a very good responder to meds. He may not even need surgery. Yeah. Or like you said, he may be a much better candidate where they can move less hair.
Mm-hmm.
It's just such a, I don't know, it just bugs me that someone's willing to do that to this kid. And I'm sure the doctor thinks it's for this kid, but I just disagree with it. Phone number, but again, I'm not a doctor. What do I know? Why are we poking our heads in medicine, Joe? You know what I'm saying?
Well, we're not doctors, so good question.
Yeah.
Because God knows the doctors always give the right answers.
Right. And we need to refer to every doctor as doctor, by the way.
Doctor.
888-659-3727. What a world. Let's see who. Let's try this one. Hey, you're on the air. Who's this and where are you calling from?
Hi, Spencer. Hi, Joe. This is Killian from Ireland. That was fascinating to listen to with the end of that call.
Well, it's good to hear from you, brothers. So what was fascinating about it?
Well, from the perspective of, you guys know me, from calling in over the years, from a guy who's done so much of this damn thing at regular intervals, I can relate completely to these points, But I actually wanted to call in today to touch on the whole technique thing, and from the perspective of more FUE and how it's a problem to the identity of the donor and how it, destroys it over time, really, by this compounding effect of scarring.
Well, that's an interesting topic that, for whatever reason, and I'm not saying proponents of FUE, because I'm a proponent of FUE, obviously. I essentially, or I did introduce it to all the guys that kind of took a stranglehold on it and started to promote scarless surgery, which I regret sometimes when I think about it. But the diminishing over time of the palpable volume in the back and the sides from consistent or several FUEs. Forget about even, any visible scarring, but just the overall thinning of the donor area is something that no one really talks about. They just talk about the visibility of the scars.
Yeah, completely. And I think there's most people now do FUE, and then guys in the past, there was obviously strip was the thing, but I think there's not too many people who now have done maybe both techniques and they're talking about it. And, I always love to talk to guys in their 20s. Now I'm in my 30s, and I did so much surgery in my 20s, but I did it nearly all by strip. But people always forget I did FUE as well.
Right.
And it's very interesting because I did about, in total, I did 2 FUE surgeries. I did 1,000 grafts for my second surgery. And I didn't really want to do it, to be honest, but we decided at the time it might be the best. And that confirmed for me everything that I had thought about it. And I said, I'm never doing this again.
Well, explain.
Years later,
what was the reason? Why would you never do it again? Is it because you felt the change in the donor that you didn't feel when you had the strip?
Yeah. So, there's a couple of bits of text online where they say, it thins the donor, and, the more you do, the scarring is visible. But it's so much worse than that, because when you've lived with a strip and then you've lived with the FUE technique, you can really appreciate how beneficial strip is to preserving that donor and keeping it really as least altered as possible. But then you do FUE, and, well, what it does is wherever you do the FUE, and you have to spread out those extractions so they don't coalesce together and leave you even in a worse situation, it leaves that whole donor area feeling, well, altered and not found in nature, because you're, untouched identity, and then you do FUE and you remove groupings of hair, and when you physically touch the hair, even not touching the scalp, it feels different. It feels like something's missing. It feels like the flow has been interrupted. It's a very hard thing to describe, but it feels like you've been... And then when you cut your hair short, as they say you can, it's not the case at all. You see the reflection from the scarring. And
well,
it
you
makes
also,
it even more
in your particular situation, you have a very thick hair, and I would say that, judging from what I've been able to see, some of the hair in the back, you may not have the same type of shingling effect the person with finer hair may have, because, correct me if I'm wrong, when you shave your head down, does it kind of almost stick out perpendicular in a perpendicular fashion to some degree, or does it lay flat when it's very short?
Honestly, I can't remember, because the last time I cut it so short would have been maybe when I was 21 or something. So I forget, to be honest.
Yeah.
Yeah.
Because a guy with hair like yours, the scar, from what I know, from what I've seen of your hair, cut very short, the light will hit the scar. It would be easier to get light to your scalp than if someone has more of a shingling effect from the finer hair.
Yeah.
From what I recall about your case, about your characteristics, I believe you do have that characteristic where you got more of a right angle to the exit angle of your donor hair, at least in the occipital region. It does tend to change in various areas of the donor scalp on different people.
Yeah.
But a lot of times it is, if it's there, it's going to be in the occipital region, which I do believe you have that particular characteristic in your donor region. So that would make sense. It's interesting you're talking about the change of hair flow due to FUE. I actually have a change in hair. Yeah, okay. I actually have a change in hair flow from my FUT because I've had so many. There's a specific direction that hair grows in the donor area as well as the top. Like it's the entire scalp is the extension of the central whorl pattern of our crowns.
So I completely know what you're talking about with the strip, Joe. And the more you do, and you can never approximate the scalp to what it once was in its positioning, because you keep removing these strips, right, and it never aligns perfectly. So the gradation it changes over time, and some of the hair,
and it's changed on me. And what's interesting is
I know that feeling.
The effect is visible when my hair is a certain length. Like right now, it's visible to me in the mirror. And I can turn. I don't know if you're watching, but when I turn my head, there's actually an area of my hair. It's almost like it's a lighter gray, or a lighter shade than the rest of the hair. And it's real. I was actually thinking about it today. So it's funny that you called in about this. I think I've had too many strips to where that stands out. And even though my donor scar is not visible, like you can comb through my hair and you can't see it. Even before I had FUE into my scar, you couldn't see it. I think I've had too many strips to where it was impossible to avoid that. If I had maybe two fewer strips, it wouldn't have been so obvious to me. People in the street have no idea, but people in the industry do. Like you can see it, and it's funny. Yeah, I was just thinking about this today. So, there's a threshold with strip where too much is too much, and it goes beyond dealing with the laxity issue. Even if you have plenty of laxity, you still may reach that point where it's too much before you run out of laxity, before you're surgically not a candidate anymore. So, when I think about FUE and how it complements FUT and vice versa, I'm a big believer in it because, I could actually have more strip if I wanted to, but I've opted not to. And the one actual FUE surgery I've had, since it's healed, my scalp feels no different than before that FUE. Granted, it wasn't a big surgery; it was 800 grafts. But given my already limited donor, I'm surprised that there's actually zero indication visibly, like aesthetically speaking, but also the fullness, which quantifies that approach you're talking about. Like you can feel the difference after FUE. That's true if too much has been taken in any given area. If the ratio is too high of grafts taken to grafts left behind in every square centimeter of the donor area. That's my experience, and that's way it's worked out on me.
It's unbelievable. I go take a piss. Joe's still talking. Did you miss me?
Still talking. Yeah. I didn't know you left.
Yeah.
No.
Well, I guess Killian can now respond. Sorry to interrupt.
It's fascinating to listen to, and I love hearing from people like Joe, because it's such a wealth of experience for, I suppose, something that most people are never going to experience. And with the it's so case dependent, isn't it, Joe? That's the thing. And even it's so interesting there, you talking about the shingling effect and how well that's going to then tailor the outcome, I suppose, of visibility for FUE from case to case. And it's just interesting, the case dependency of it. Like for me, I know I am not an FUE candidate because, well, psychologically, when I feel it, palpability, all of this intertwined, I can see too much of a trade-off over the strip. And it's interesting. The strip, for me, the density remains so almost the same. It was like the first, I would say the first 2 to 3 surgeries felt like a free pass. Of course they're not. And then after that, the fourth one, the donor changed a bit, and it feels a little thinner in a small radius around, the scar. But
well, that's why I think these conversations are so important, because what most consumers of hair transplants see today is just quick online before and afters, somebody's experience in a limousine, some influencer saying how they got their hair back, and no one really takes the time to talk about all the emotional aspects that are involved, the whole process, like a caller like Mike, what he's going through, how every patient is different, our physiology, they make it like it's just this simple outpatient cookie cutter procedure that anyone could have done. So everyone with every different type of, characteristic of hair and scalp, they think they're all going to get the same type of results. And that's just certainly not the case.
Copy and paste.
Yeah.
It really isn't. And I think it's so interesting to highlight that, because I think it goes back to the individual's value system, which is different from person to person. Like, you evolve as a patient over the years, and you learn what you value more, but there's always something at the start that is going to stick out. And for me, it was always, I value keeping my donor thick, and that dictates everything to fundamentally what technique you choose.
Yeah.
And it can't be undone. Yeah. And the starting point, I think, is integral, because that sets the trajectory. And if you get that wrong, I mean, if you, like, for example, if I had gone for my first surgery, we always kept things small. But let's say I went down a different avenue, and I hadn't have listened to the Balter back in the day, and then I went off like every other guy, and I had like 2,300 grafts from, a doctor who doesn't respect the donor as much, who doesn't align with a value system that you develop as a patient. Everything would be so different now, and I wouldn't have the hair I'd have, because within a few hours my donor would have been thinned, and it would have been irreversible.
And these kids, sadly, they're just not, they're low information consumers in this, really serious medical, this is surgery.
Yeah.
And they're willing to just take the information from an ad. They're willing to have a WhatsApp consultation with some guy in a different fucking country, and that's it. They're not interested in seeing patients. They're not interested in meeting patients. They're not interested in maybe sitting down and having a consult with the doctor in person. They don't understand that in many cases, especially when you're traveling overseas, the doctor's going to spend very little time with you, if any.
Mm-hmm.
They don't know any of this. And I'm telling you, when I think about this kid, I keep bringing him up because it's kind of bugging me that, and maybe it shouldn't bother me, but it does. I hope he listens. I hope he somehow finds this show, or he reads what I posted on his page. I don't think this guy, Zeph, should have a hair transplant at this point. I don't think he's prepared, and I don't think he's been given all the information he needs to make an informed decision.
Agreed.
I don't know if you know this kid. You know what I'm talking about?
I do. Yeah.
Now, what are your thoughts? And you're doing this now. You're involved in the industry, Killian. Have you taken a look at his page, at his scalp, at his current situation? What are your thoughts on it?
This is the guy who did a lot of microneedling, isn't it?
A lot of microneedling. Started with the rosemary oil, then he got on different topicals.
Yeah, all of this. I've had a brief look at it here and there because it keeps popping up on my feed. Mm-hmm. And from looking at the before photos, I would think, just looking at it logically, that, okay, there's probably something he's not telling people. I'm sure he's on some sort of tablet medication because, as we know, all of these natural products and oils do nothing because, well, number one, they have to permeate the stratum corneum, which they cannot do unless it's a man-made active ingredient. And number two, they have to be at a concentration that has medicinal effects, which an oil won't. So I don't buy that for a second. So there's something else going on. And with regards to his microneedling, I mean, it's such a double-edged sword because, okay, I get it that with the whole wound healing response and some of those growth factors towards maybe angiogenesis, keratinocyte growth factor, all these things might help with the hair cycling. But when someone is so advanced in their balding like him, and for them to have any improvement because they're so far gone in their anagen phases, I think it will only give a more limited time to the results they have, if you're getting me, if I'm making sense.
You do make sense, and no one really talks about we're born with a relatively a finite number of anagen phases, and no one really understands the process. They think they're just moving hair from one place to another, and that's it. And I have hair in the back, now I'm going to put it in the front, and I'm not going to be bald anymore. Well, people, this is a moving target, and every hair that's being moved has to be checked. The entire scalp has to be checked for miniaturization. Mm-hmm. What level of miniaturization is happening right now? How stable is the person on medication? Even if the person's stable now for the next couple of years, will that yield a long-lasting result? And will this person be happy once he starts to see the result diminishing, and then he's left with nothing but scars on the back of his head and his dick in his hand?
Yeah, I totally agree. And I think with this guy, because we can't forget where he's come from, I think he's at the end of the day, you can't go backwards with hair cycling. He's too far gone, and it represents a kind of, almost illusion of improvement that doesn't have permanency to it. So I think if you get a transplant, I don't think it would last at all. I think it would probably rapidly fall apart when he crosses that threshold of hair cycling that might only be around the corner.
Well,
his thing is like smokes and mirrors.
I guess my thought is it's hard. It's difficult for me to understand how a doctor, and I don't know if he's going through with it or not, but how especially a person who is is probably considered to be a decent hair transplant surgeon. I know he's considering going out. Someone here in Los Angeles. I can't see someone wanting to risk their reputation on that, except for short-term gains. And like I said on my live last night, it takes a year before anyone sees any real results. If this guy documents this in real time, potentially thousands of people are going to end up having hair transplanted, maybe going to the same doctor. Doctor's just going to rack them, stack them, and hope for the best for this kid, Zeph. My hope is if he does have something done, maybe, my advice to him would be don't document it until after. Okay, have all of everything recorded, have it all set up, and then wait a year. And if everything turns out the way you planned, then start, putting out the content.
If I might add another point to that it just crossed my mind now thinking of it. Let's say he went and had a transplant. Again, thinking about where his hair is going and, further hair cycling and how he's gone through more anagen. When he has his transplant, right, those hairs are going to fall out and go into a resting phase. And he's going to go through more hair cycling and put himself deliberately through it. And we don't really know what the outcome is going to be of that. We can only say, logically, again, it's going to be weaker.
Yeah.
I'm listening. I'm reading something in the chat room. This is hilarious. Kobrenisms. Time on tissue.
Oh, yeah.
Your due diligence. Not all PRP is created equal.
Surgery last resort.
That's fucking awesome. But Killian, you're
good.
Listen, I mean, we can speak about this to a blue in the face. What people are going to say is, well, the doctor says I'm okay. I'm going to get the green light from the doctor. So what do you guys know? You're not doctors. All right.
Too common.
Good luck.
I think people aren't obsessed with the donor. I think the key to doing good in this is to have a healthy fear of FUE and not wanting to deplete your donor, and to be obsessed with the donor more honestly, more than the front. I remember when I was doing all of this, I looked at the donor way more than I did at the front.
Yeah. I just don't.
Right.
I don't think people are prepared. They're not fully informed. They want to believe what they want to believe, and if there's doctors out there that are willing to tell them what they want to hear, then that's just the way it is. There's nothing we can do. Yes, jaundice eye. Look at everything with a jaundice eye. But listen, Killian, we're going to take another call. It's always great hearing from you. Killian is the hair chemist. He's a American Hair Loss Association trusted content creator. We don't have many of those. And first of all, Killian, I really appreciate how much you appreciate being a part of things. And you're doing really good work. I want you to know that.
Thank you for that. It's it's a learning curve, and I love producing content on my channel that is educational, and I learn from it as well, because sometimes you keep all of this in your head, and when you say it and you listen to it back, it's crazy.
But it's also interesting to see the response from people. Some is very positive, and some is kind of negative.
Yeah.
Yeah, no, for sure. But I'm hopeful.
Welcome to our world.
I can see FUT. I can see more people are interested in this, and more people. People who follow you, they kind of start to absorb some of your traits and think like you. And I think, as long as you're saying the right things, that's a good thing. And I can see people now are caring more about that donor and looking at the strip. So this is all that I want to do.
Well, I think it's happening. And like I said on my last Instagram post, I mean, I definitely see the pendulum swinging back to some degree. A lot of younger guys are now asking about, this other option. Am I a better candidate for strip? Will this give me a better, long haul view, or a result than FUE alone? Those questions weren't being asked just a couple of years ago.
Right.
Amazing.
All right, brother. It's great hearing from you. Thanks for the call.
Pleasure seeing you guys.
Take care.
See you again.
All right, take care.
Take care, Killian. Bye-bye.
See you, Joe.
Killian the Hair Chemist. You can check him out on YouTube. Joe, we have time for another call?
Sure.
All
Let's
right.
do it.
Hey, you're on the air. Who's this and where are you calling from?
Hello.
Yes.
Hello.
Hey guys, it's Devin Boyle from Melbourne, Australia.
Oh, hey. How are you, Doc? You sound a little. You sound a little
Devin,
muddled.
yeah.
You sound like you're underwater.
Do I?
Yeah.
Sorry, I'm calling on my iPad. I'm good. I'm good. How are you?
We're good. I'm good. I don't know how
We're
Joe
good.
is.
Yeah. I'm fine. And
I'm a little
everyone
hungover
that's,
today.
listening, this is Dr. Bevan Boy-Rule from Australia. He's a dermatologist and lots of experience with oral minoxidil as well. So glad to have you on. What's going on, Doc?
So well, first of all, I'd just like to say I really enjoyed last week's show with Dr. Mittal. It was really interesting hearing some of his insights, especially one that sticks to my mind is how he almost has two sets of singles. One that he uses from the nape, just immediately anterior to the other singles that then he places. I thought that was quite interesting.
Yeah, it was a great call, and I love the fact that he's not even he's not a guy who performs FUT, but he said on the air that he still believes that FUT is essentially the gold standard, which is I found very interesting.
Yeah, that's testament to his honesty.
Yes, 100%.
Yeah, but I wanted to talk to you guys about something that I think is quite worrying. You know, as though there's not enough worrying things in this industry.
Yeah.
That's it's hair transplants in trans women. I don't know if you guys have thought about that. I'm sure you have.
Sure.
You know,
Daily.
I've seen. Yeah. I've seen a few people for consultations lately, and you know there isn't a single one of them who seems, you know, with all due respect, to be in touch with reality. You know, there's so many. It's such a can of worms. You know, first of all, obviously, as you know, a lot of these guys are. Well, I'm saying guys. I should say trans women. They're young.
Yes.
And you know the ones who want to transition early, they all want a low hairline. Obviously, you know, with men, I don't know, cis men is that the right term?
You know what? I'm almost 60 years old, so I don't even know what's going on. You know?
So yeah, if well, cis men, you know, if that's the right term, who progress to advanced baldness, you know, there's always in the right situations.
You mean men, like men, like regular men.
Men,
Yeah.
men, some beard hair.
Yes.
Yeah.
And all the ones I've seen have been white patients, and some of them have asked for. You know, they come in sort of saying that they want a hairline that you associate more with an Indian woman or sometimes a Chinese woman, right? An Asian woman. Yeah, as you guys well know, in women especially, you know, in men too, the ethnic background can make a difference.
It's a huge difference
to what a reasonable hairline looks like.
Yeah.
You know, black men, for example, have a hairline that often would not look good on a white man.
Yeah.
You know, this
sounds like somebody's beating up your kid in the background.
Yeah, my son. Sorry, you know, he probably disagrees with what I'm saying. The other problem, guys, I've written some of those down because I've just there's so many issues. Many of them refuse finasteride because they think it might mess with their transition, you know, male to female transition.
That's interesting.
And do you know what's even more dodgy is I've seen some of these guys who've come saying that, you know, they're going to a plastic surgeon who's offering them like this kind of package deal where they'll have the facelift, they'll have their nose reconstructed, they'll have the hair done at the same time. So you know, it's a one-stop shop. I'm sure you guys have heard about this.
Absolutely.
Too.
Oh yeah.
And I've had this one person tell me, I don't even know which pronoun to use anymore. This one person tell me that the plastic surgeon told them that they're going to have a brow lift. So they're going to bring, obviously, I'm sure you guys know what a brow lift is.
Sure. So they're going to basically do a hairline lowering procedure simultaneously.
Well, what even worse, a brow lift, and in order to do the brow lift, they'll cut a strip from ear to ear across the mid scalp. If you can picture what I'm talking about, right?
Oh,
so the strip is across the mid scalp, and the plastic surgeon said, "Well, look, we can use that strip for your hair transplant," and that's a strip going across the top of the scalp.
Sweet Jesus.
Do you know what I'm saying?
So basically, let's put miniaturized hairs into your hair transplant, or hair that will eventually miniaturize.
Unbelievable.
Let's take some of your balding scalp and put it back into more balding scalp.
Yeah.
Exactly.
Yeah.
Exactly. Why put that strip in the bin that we've just used for your brow lift? We'll use that for your hair transplant.
I tell you though, man, in your country there's a lot of janky shit that goes on in the cosmetic surgery and plastic surgery world. I mean, it happens here too, but Jesus.
Yeah, it's crazy. It's crazy. And I was talking to a friend of mine who's a hairdresser, and he says to me that it's true. These you may want to identify as a woman, and with all due respect, but that doesn't necessarily mean that you think like a woman. And I saw a woman a few weeks back who was considering a hair transplant for, she's got the Christmas tree pattern of hair loss. And this woman, she's already thinking 10 steps ahead. She's thinking, I want to have a fringe. This is how I'm going to wear my hair. This is going to be my hairstyle and so on. Whereas these trans women, they think this is the hairline that I want, full stop.
Right.
With no thought about, what's going to happen afterwards. Do I want a fringe? Like women will think, I want a fringe. I want to tie my hair back.
Well, with all due respect to trans women, they're also, many of them they're cutting their dicks off. So they're not necessarily thinking, with, I'm not going to say it's irrational, but they're not necessarily, you used the good word. I mean, there is some sort of delusional situation here, and they think that this is something that you're going to be able to provide, just like the plastic surgeon or the transgender surgeon is going to be able to just remove their parts and reconstruct them, and everything's going to be completely back to normal, and they're going to be able to function fully as a woman. So, I mean, they are kind of living in a little bit of a different world, and so why should anything be different with the hair? You know what I'm saying?
Mm-hmm.
I mean, was that rude or is that incorrect? I mean, I don't mean to be politically incorrect, but I mean,
Not at all. And, I don't know if I'm, maybe, some people might call me rude as well, but I don't know what you guys think, but when people tell me that, they're contemplating this surgery, one of my first questions to them is, look, is there any possibility that you might want to identify as a man again in the future? I mean, fortunately, no one's been offended by that so far,
right.
But that's the first thing I ask them.
Well, I think that's a reasonable question.
Then the female hairline will look absolutely dreadful.
Yeah. And I don't think that these women, trans women, are prepared for the reality that, it takes a tremendous amount of hair to be moved, if they are even candidates, to create a really strong female hairline. A lot of these women are getting their hairline reductions or the hairline forwarding surgery, which in some cases could work well, in some cases it doesn't. Even with hormones, some women, trans women, will continue to progress, and that's why it's interesting that they refuse to take, at least the people you speak with, refuse to take finasteride, because you would think, well, wait a second. I want to make sure that my hair loss stops. If I'm going to go through this process and I really want to be a woman and look like a woman. So, yeah, I mean, I there's a lot of problems. I know some docs who do very well, who've really helped a lot of these women. But it seems like the women, at least, I was speaking to Scott Bowden about this, and we recorded some segments about it a few years ago. At least the women that he's dealt with seem to be reasonable with their expectations.
Mm-hmm.
But that doesn't seem to be the case in your practice.
Well, look, it's a fact also that a lot of these people, sadly have mental issues.
How dare you? No, I agree. Yeah.
And this is, and many of them are quite vulnerable.
Yes.
But there are certain things that I suppose no matter how much you try to look like a woman or to think like a woman, we'll never.
I've been telling Joe that for years.
Look completely real.
Yes.
One thing I see, for instance, is as you know, with the majority of guys, the along the hairline, the hair grows forward at a relatively acute angle, so forward either slightly to the right or to the left. But in a lot of women, that's not the case. In a lot of women, you look at the hairline and the hair grows. The angle is a 90-degree angle. There's even a few women where the hair actually grows backwards.
Yes.
And I find a lot of these women are the women who, for example, will tie their hair back. They'll tie their hair in a ponytail, or
Right.
sometimes the hair grows to the right or to the left, and they will be the women who either part their hair to the right or part their hair to the left, because obviously the direction of the hair dictates the hairstyle, right?
Mm-hmm.
Yeah.
So
Yep.
these guys will have a receded hairline, but admittedly the direction is still either forward or a variation of forward. So if they're picturing in their head that they want to have, they want to part their hair a certain way, or they want to tie their hair in a certain way, it may never work.
I always suggest, and I have had trans women contact me in the past, and there's a couple that actually follow me, and they ask about hair transplant surgery. And while I don't normally DM with people, I think it would be remiss of me and irresponsible of me. I usually would like these people to call in, but I don't know, they never do. But I provide them with the facts, and I also suggest that if they have enough hair currently, they might want to consider wearing hair for a while during their transition. And women could really get away with wearing hair, and they can look great, and they don't have to go through the surgical procedure. And no one will be the wiser if it's done well. And one person actually thought that was a great suggestion and ended up going out and buying hair. And she's very happy with it. So she didn't go through the transplant. The other person never got back to me. So I don't know if you would ever make that suggestion, or if you feel these people would be insulted by that suggestion.
Well, I think it's interesting, Doc. I just want to mention, you said two things that really caught my attention. Number one, I love your description of what women go through as far as a pattern hair loss. I loved the fact that you referred to it as a Christmas tree. I immediately understood what you're talking about. I've never heard anyone say that before. I think that I'm stealing that. That's a perfect description. I know exactly what you're talking about. But the other thing I thought was interesting is you said, I don't know if this is going to offend anyone, but I've been asking the question, do they feel like they're absolutely not going to feel like identifying as a man again? And I think that every physician will go through some sort of screening process when they're talking to a patient, and judging what the patient's goals are versus the reality based on how they present as a patient, not just their physical characteristics or their surgical characteristics, but also their mental characteristics. And I think that if you ever have a patient that is offended by the question in and of itself, that alone should be a red flag against surgery, because it's a perfectly logical question and it makes perfect sense. So I just wanted to comment on that, because I think that's that's with any patient, there's always a screening process.
Well, we also live in such a touchy
think that
time.
Yeah, of course.
And we're talking about, when we're talking about trans women, and we're talking about them considering having, significant, like I talked about their, transitioning surgery, which is pretty major and frightening to me. But this is major. This will alter their lives forever. And I don't think they're coming into this realizing, like most people, but they are not going into this realizing what this can do and what the limitations are. So I don't know, Doc. I mean, to me, that seems like a very difficult tightrope to walk. And if you're dealing with someone who's very vulnerable and very emotional, even rejecting them may, be problematic. Have you found that to be the case?
Well, like as with guys who
Spencer,
have
take the camera off
their mindset on having surgery, the one I mentioned who's having the package deal with the brow lift and all the rest of it, she's going to Spain. Well, she wants to go to Spain. And I think that's where the plastic surgeon suggested using the strip from across the top of the scalp for the transplant. So.
Well, and now did you express to her that why that wouldn't be a good idea?
Yeah, absolutely. I mean, fortunately, she hasn't done anything yet. She hasn't been. Yeah, she's.
You could suggest her if she wants. She can call the show or watch the program, and I'd be more than happy to kind of speak to her from, my perspective, not being a physician, but being in the industry for so long, and maybe giving her a little bit of a reality check of what she could experience if things go wrong, and also the limitations of things.
Actually, that's a good thought. I'll probably ask her to give you guys a ring.
Yeah, I mean, I love to speak. I love to speak to her, and I think, listen, as women, women are used to wearing makeup, and and as this person transitions, there's going to be more stuff that she's going to have to do to be feminine, right? Wearing hair is kind of like a rite of passage for women now. So to me, it's like that's the first step before you consider having surgery. Now, is this particular person significantly balding?
She is Norwood 3.5, probably.
Okay. All right.
Yeah.
Yeah. So I mean, yeah, that's
if I remember correctly.
I mean, she could wear a partial in the front and then have extensions that can make her look like she has an incredible head of hair. It's just going to be a process. I mean, do you think you think if you were able to, if she would accept the reality of surgery, do you think she'd be happy with the end result?
Look, she's probably going to be dealing with her nose and her, if she's unhappy with her nose or her brow lift, or it's just, she's actually quite particular. So I think she will find if it's not what she's after, she probably won't be very happy. No.
Yeah.
And with the extensions, a lot of her hairs along the hairline are hairs that are quite shorter, and that's one of the issues that some of them have mentioned. They want to have long hair like biological women, and one of the first steps with balding, as you guys are aware, is the anagen phase gets shorter and shorter. So often these hairs along the hairline are quite short.
Right.
And they can't have them long, and wearing extensions attached to these short hairs might look a bit not very good.
Well, yeah, I mean, she definitely could not wear extensions in the front. What she would have to do is either wear a really nice wig, or she would have to have a partial in the front, or even, an entire kind of partial on top. And then you could add extensions to that. And there are people who transition that do that. Now, it's a process, and you're not causing yourself a lot of traction because you're actually wearing hair and then attaching hair. But a lot of women wear hair, and there's also a lot of balding women out there that are wearing hair. So it's not, given the fact that she is going through all this transitioning, all these surgeries, it doesn't seem out of the realm of possibility to accept, hey, okay, I want to look like a woman with beautiful hair. I can do this, and I'm going to look great. And she really would only have to share it with her partners.
No.
No,
yeah, there's one of them who had a fair bit of anterior hairline recession, to whom I suggested a hairpiece. I don't know what she's, whether she took that on or.
Yeah, what I find interesting is that could also be offensive to people. Like you really have to tread lightly with these conversations. I can't even, I'm not a person who treads lightly. So if this person calls me, she's going to get the truth. But being in the position that you're in, being a physician, people are coming to you for hope and help, and they want to hear what they want to hear. And sometimes when they don't hear that, that can really upset them. So you definitely have to walk. It's like walking on rice paper. You have to be very delicate.
Yeah, absolutely. It's but I mean, we're well aware of all the problems that go with biological men having transplants and not the right candidates and people having bad surgery, etc. But I think this could be disastrous as well if people are going in misinformed and wanting things that are completely unrealistic.
Well,
and people who, virtually all of whom are in a vulnerable state and probably not have their head fully on their shoulders.
And I agree with that. And you talk about being unrealistic. It's going to be very difficult for a lot of people who transition to really be the sex that they want to be, to really pull it off completely. I mean, I've seen some girls. I was actually I had a conversation with this Asian chick, and she still had her parts. And at first, I probably wouldn't have known she was a dude. I mean, after she told me, I took a look and I'm like, oh yeah, I could see it. Now I didn't tell her that, but I'm thinking that to myself. But this person had extremely thick hair. And looked really, really feminine. But that's not that common, even with surgery.
How old was she?
She was probably in her 20s, maybe 27 or something like that. Good looking. Must have been a good looking dude because she made a good looking woman. And after a couple of more drinks, who knows what would have happened?
Don't cross swords.
So
Don't cross swords.
Look, I got no problem with it. Hasn't happened yet, but I mean, Jesus, in today's world, you never know.
You never know.
Yeah. But no, I think this is a really important topic, and I'm glad that you brought it up. No one's really talking about it. You know how doctors are talking about it? They talk about it as, this is an empowering procedure for these women, and it's kind of like the final touch.
Well,
that's how they bill it.
There's a high rate of suicide among these people.
Oh yeah.
I can only imagine. I can only imagine how difficult their lives are. So, all right, brother. Well, listen, is there anything else you want to add before? Because I can see Joe's got to get out of here.
No, just one quick one for you guys. I saw a guy a few weeks back who had a transplant in Turkey. He had a fair few grafts. Sadly, the result wasn't great. And I asked him how many grafts he had, And guess what he said?
8,000.
No, his reply was, "What's a graft?"
That is a beautiful story. And I think that sums it up completely.
Yeah.
About all these low information dudes going to have surgery.
Wah, 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 wah.
All right, Doc. Thank you so much for the call.
All right.
It was great hearing you.
Okay, thank you.
Good to hear
care.
from you, Doc.
Have a good weekend.
Bye-bye.
Yeah.
Bye-bye.
You too. All right, Joe, you want to go or do you want to take a call? What are you doing? What's the story?
We can do one more.
Oh, they hung up. Fuck them. Let's get out of here. All right, guys. Listen, I want to thank everyone for tuning in. It's always fun. Yeah. Thank you everyone in the chat room who's hanging out in Joe's chat. I may do a live this week. We'll see. No, will I be? No, I won't be able to this week. Maybe over the weekend on Instagram. Follow me on Instagram at Spencer Kobren. Follow Joe at the Joe Tillman official. Joe's page. What is it?
Joe Tillman official. You had it the first time.
Joe Tillman official. And I just want to let you guys know I am going to be starting something different. It's not going to be a call-in broadcast. We will let you guys know right here on The Bald Truth. Mm-hmm. And it's I have a lot of hope for the broadcast. Let's put it this way. We're going to be speaking to the patients. We're going to be speaking to some well-known people about their hair loss and their hair transplant experiences. We're going to have a lot of doctors, but not out there like other guys do, where they're just pimping out surgery and shit like that.
Nope.
And we won't be taking your calls.
No surgery pimping.
And we won't be taking your calls during this broadcast. But you guys we'll let you guys know about that. Anything you want to pimp out, Joe?
No, just follow us on Instagram. Hit the like button if you haven't hit the like button on this video yet, and if you're not subscribed, why are you not subscribed? You get to chat in the chat room if you're subscribed. So subscribe if you haven't subscribed. That's too much subscribing. You know what I'm saying? That's it.
I think I'm gonna order like a pepperoni pizza right now.
That's what I'm thinking.
It's so bad for me, brother. But like the day after drinking, I just want to, and I'll be bloated for like a week.
Yeah.
How do you keep in shape and take care of yourself in this world, man? It's really difficult. I do my best.
My wife is out of town. I've been good about my intake. I've been sticking with the meat and the vegetables, but tonight I might stray. I might get a pizza.
I had a bowl of pasta last night with truffles, and it was truffle and sausage pasta. Oh, I had some vino. It's funny, I really didn't even drink that much. I would say I had a total of 4 drinks, but one was a Jameson. Well, I can't do it anymore. I don't see how adults or people of our age group even drink once a week anymore.
Well, it's called persistence, my friend. No one likes a quitter. No one likes a quitter.
And you can see it on their faces, brother. Some people in this industry, they're not doing well. All right, guys, until next time.
Yeah.
Until next time, be strong, God bless, and thank you so much for listening. Have a great weekend.
Thank you very much. I'm sorry for any inconvenience you may have been put to prior to the programme, and I'm glad you enjoyed it. And if you could now leave by the exits at the rear, that'd be splendid. Thank you.